Hello, my name is Dr. Sabrina Fabi, and today you're going to be seeing the use of PLLA, or Sculptra aesthetic as we have it here in the United States, for a little bit of improvement of skin laxity as well as to add volume to the buttock. I'm actually also going to be doing it for the anterior thighs, because what we see as a function of age is that we lose both volume and our capacity to stimulate new collagen production. So this product allows us to address both. It adds a little bit of volume by also thickening up those collagen bundles that we lose as a function of age. We also improve the skin quality, so that this kind of waviness that we start to see along the buttock that kind of mimics cellulite looks better. And so with our patient today, you're going to see me, I'm going to first mark where I'm going to be treating. And you can see that she has more of an indentation on the left side, but then for this waviness through here, I'm also going to put a little bit of Sculptra and sprinkle it throughout so that we can both add a little bit of projection and volume while smoothing out the skin. Many patients come looking for laser treatments to do this, and although we have many, and there's a good place for many of them, it's ideally the combination that gives you the best results. So with her, a combination of all therapy to lift the buttock, and then a little bit of Sculptra done immediately after, or even a month later, is going to give her the best results. So just watch. So here we are, and this is a common request I get for patients, in that they want a little bit more projection of their butt. They want to smoothen out the skin of their butt, and really your only alternative here is a lower body lift. And although that procedure has increased by 33% in the last 10 years, it's a procedure that leaves you with a scar all along your belt line. And so it's something that has a lot of downtime, about 3 weeks. You have to be so careful that the scar doesn't dehisce or spread. And so patients are always looking for non-surgical alternatives in order to get the results that they want. And so, especially in Southern California, where patients are in their bathing suits or surfing a lot of the time during the year, this is a common request for my patients. So I commonly do all therapy to lift the buttock. We did a clinical trial here, and we saw a decent improvement after a single treatment. And then I invite them back to do a little bit of Sculptra. So in our patient today, you can see that she's got these, little areas of volume deficit that kind of create these creases and waviness of the skin in those areas. So that's what I'm going to use a little bit of Sculptra to fill in, smoothen out, and that will give the illusion of more volume and smoother skin. The alternative here is obviously fat grafting and transfer, but the limitation with that procedure is that you need to have an area to take the fat from, and you run the risk of contour irregularities like we're causing this patient from taking the fat out in one area to smoothen out the area somewhere else on the body. And then there's never a guarantee with fat transfer that you're going to get take of that fat, that fat's actually going to live where you inject it. And so for that reason, this is another more cost-effective way to address contour irregularities as well as laxity on the body. So here we are, we just completed injecting 2 vials into each cheek of Sculptra, and you can see that it just looks smoother. There's not a lot of blood, not a lot of bruising, and over the next month she's going to stimulate new collagen to really thicken up that skin, improve the waviness that she's seen in her buttock that makes it look like she has cellulite, and also give her a little bit more volume so she looks like she has a little bit more fullness and a more youthful projection of her buttock. So for more information on Sculptra and how you can get it into your butt to improve overall contour as well as any changes in skin irregularity, visit us at clderm.com.